My name is Laura-Kopp, and I am the president and CEO here at CASI. And the pandemic was a really unique experience for us. I think looking back, we can see how significant the impact was on seniors. We know that 97% of the deaths, both in Iowa and Scott County, have been adults over the age of 50. Mostly because they have pre-existing conditions and other vulnerabilities that kind of put them at risk. So, for us at the beginning of the pandemic, we knew immediately that providing large group activities in a large format for vulnerable older adults was not going to be possible, and it simply was not the responsible thing to do. And so we took that risk and we shut down our services both here at the community center as well as at Jane's Place, our adult day services program. We shuttered those for an entire year, which cost us close to $700,000 in earned revenue. But we're very proud to say that our senior advocacy program, which is made up of 6 social workers, was a critical emergency response for Scott County in serving seniors, the hardest hit population, during especially the hardest parts of the pandemic starting in March 2020. Our senior advocates were going out into the community during the height of the pandemic. They were connecting with older adults and making sure that they had the resources and services that they needed to survive those early days when you needed to connect virtually with just about everybody to get your prescriptions, to meet with your doctor, to get your groceries. We had a lot of food instability in those early days of the pandemic. And fortunately, our advocacy team and our organization as a whole is very nimble and able to respond in times of emergency, in times of crisis. And we were able to do that. We developed a meal delivery service for seniors that were quarantining and heavily isolating during those times. That program became exceptionally important as the derecho swept through that August, and we had seniors that were, for lack of a better word, trapped in multi-level affordable housing senior units with no refrigeration, no electricity, and no access to elevators to vacate the premises. So at that time, our social workers were helping them to order food and clear out their spoiled items, clean out their refrigerators and discard of all of that rotten food product. So very instrumental in those early days. And then of course, when the vaccine became available, we partnered with the Scott County Health Department, Community Health Care, and Genesis Health System to get more than 4,000 older adults vaccinated, because most folks will remember that the registration process for getting access to the vaccine was an online process, and many of our older adults, especially those 70 and older, some didn't have access to computers, some didn't have Wi-Fi in their apartments or in their homes, and others just simply did not have the knowledge to know how to access that. And so with a team of 3 and a handful of volunteers, we were able to organize several vaccine clinics here at the center and work very closely with the health department and our partners in the medical field like Genesis to get seniors access to those vaccines. We reopened in March of 2021, a year to the date that we had closed, and it has been a very slow trickle back to normal. Soon after we reopened, we experienced Delta and Omicron variants, and that again pushed people away. I think seniors are still very frightened, especially now as more people who are fully vaccinated and boosted are catching COVID. I think they are more scared, and they still have some of that anxiety about what will happen if I do catch the virus. And so they're not going to places that have large group activities, that have congregate type settings. And so that's really, forced us to look at the way that we provide programming and look at the way that we're staffing our organization. This year, again, we're looking at probably a $200,000 to $250,000 shortfall because of the slow return of our members and our participants in our programs that drive revenue. So we're very excited that we're getting ready to celebrate our 50th anniversary next year, but it's been a slow go. It's been a slow go to return to normal. So.
Yeah, and I'm wondering if you could talk a little bit about Jane's Place and what its role is, and if there's anything like it in the state.
Sure, sure. So, CASI is one of only two nationally accredited senior centers here in the state of Iowa. And we are one of the only senior centers that has a co-located adult day services program. So Jane's Place is Eastern Iowa's only adult day service program specifically for individuals with Alzheimer's disease and dementia. And much like with your children that can't stay home alone by themselves, this program allows caregivers to drop off their loved one that has dementia and feel confident that they are being cared for, that their medical issues are being taken care of, that they're receiving adequate nutrition, that they are engaging in activities, they're not isolating, and they are being social. And we know that adult day service programs have been shown to help individuals with dementia remain independent for up to 18 to 24 months longer than those that don't have access to those programs. So it is a critical piece of the aging journey here in Scott County, and CASI is very proud to provide one of the only programs that does that.
Awesome. Anything else you'd like to add?